So Margaret Moga will talk about exceptional experiences of healers, a survey of healing touch practitioners and students.
Okay. All right, thank you. Okay. I'm going to talk about the exceptional experiences of healers, focusing on healing touch practitioners. This is actually a photo. I can get the of a class, healing touch class. Healing touch is a form of energy healing, similar to like Reiki or Qigong. Just to clarify that I'm basically an anatomist who got interested in energy healing, actually an ICEAM conference. I actually went to a healing touch demonstration, and while I was sitting in the audience about the third row back, I could feel this wind, this suction pulling me in, and I thought, oh my God, what is this? And so I started taking some of the classes out of curiosity, and then eventually started doing research. I've actually published a study on magnetic field changes during healing touch, and so this is just sort of a progression of my interest in what's going on during healing touch, is to look at their experiences in a qualitative study of these healers. Healing touch was started by a group of holistic nurses, and it sort of influences how they present themselves, because they want to be known as a complementary therapy working in hospitals and clinics. For example, I have one healing touch practitioner I've worked with as a nurse who does healing touch, energy healing on patients while they're in a dialysis unit. And so she has to be careful. She can't pull out her pendulum. She can't do woo-woo stuff. But basically, she can provide comfort and energy healing actually in a hospital. So that's what their goal is to be in the mainstream medicine. Because it's developed by nurses, it has a nice standardized education. There's 5 two-day workshops. It's almost like a semester course that's been divided up across 5 weekends. And between levels 4 and 5, students have to do 100 healing touch sessions and document them in write-ups. But what interested me is that the exceptional experiences are pretty much hidden from view, public view. If you look at the 2 healing touch websites, Healing Touch Program and Healing Beyond Borders are the 2 big groups offering education in healing touch. They don't really want to talk about these unusual experiences. But they look for them when the students write up their 100 cases. They're looking for them. As one example, and actually I've gone through it, I had a client who basically had trouble with depression and alcohol abuse. And when I was trying to fill her field with light, her biofield, basically the field coexistent with her body, there was a density actually in her field up in the head area, and I tried to remove it with light. Eventually, I had to use the light to dissolve the density, and I put that in my write-ups. And they were like, good, good, you know, because they're looking for extrasensory perceptions as evidence that you've got this energy healing sort of thing. But they keep it hidden because they're working in hospitals. So it's a balance, and it's even writing papers in this area. I have to keep a balance between the paranormal aspect and then the mainstream medicine aspect. It's a little tricky. So anyway, so I've always had this interest in the experiences of healers, and so I set up an online survey of healing touch practitioners to examine particularly the unusual sensory, visual, auditory, touch, and out-of-ordinary experiences of healing touch practitioners and students. I included students because I found in my earlier study of magnetic field activity that when they reached level 4 and sometimes level 3, they could begin to create changes in the magnetic field in the room. So really didn't have to complete the curriculum before they could actually create effects, measurable effects in the room. So I was very interested. It's a neglected area is what is the development of a healer? When are they really competent, and when can they create change in a space in their training? So it's a neglected area. So I included them in this survey. It was anonymous and voluntary. I advertised through, for example, Energy Magazine, healing touch groups, several large healing touch groups in the country. 183 individuals completed the survey, 25 to 80 years old, mean age 58 years, mostly female, 88% female. mostly in the USA, 90%, some Canada and other countries, and across 37 different states, so really a wide distribution of people who are participating. And what's nice is because it's a standardized curriculum, these people all have received the same training. Overall, 60% of the respondents were practitioners, had completed the training, and 40% were students. The scale that I used was 37 closed-end questions, a Likert scale, with higher scores indicating more frequent experience. So I was looking at how frequent particular experiences were. I also had open-ended questions describing unusual experiences. So I could get, if there's something I was missing in the survey, I would hopefully get it in the open-ended. So this is just an example of some of the Likert scores. These are mean averages for the practitioners and for the students for particular questions. These are just a summary of these questions. And then I include a couple comments in the bottom here of actual responses in the open-ended questions that, practitioners or students have basically written in. So just looking at the touch sensations were the most commonly reported, most commonly frequently perceived was a sense of touch. The big one, of course, is warmth or heat, basically. And what makes this exceptional is that the intensity of the heat. It's like a heating pad on high. It's not the normal warmth of a human being touching another human being. So that's what makes it exceptional. There's other sensations like vibration, pulsation. They talk about pulsation through their hands. They can feel pulsation when they have their hands on it, resting on a client. Heaviness, congestion. It's common for healing touch practitioners when they're moving their hands through the biofield above the client to feel areas that are heavier. It's almost like going through like a syrup, basically, rather than a clear water, still water. What was interesting, sensations of coolness or cold as they move their hands through the field was more common in practitioners than students. It seems to be a more advanced skill, being able to detect coolness and cold. A prickly sensation may have something to do with electrostatic phenomena within energy healing, the buildup of charge, buildup of body voltage and discharge that happens during healing. Pushing, pulling, very reminiscent of that pulling experience I had initially that got me interested. And these are just, what was interesting was several of them talked about the diverse experiences, how they would describe it: bubbles, buzzing, stickiness, thickness, all the sort of sensations they feel with their hands and body. Bubbles came up on a number of occasions. I hadn't expected that, so I'm not sure what that symptom, that sensation means. And just looking at visual sensations were less common. You can see there's a 2.71 versus in the threes, basically. A big one was seeing spiritual guides either in their mind's eye or on peripheral vision was another common way that they saw guides in the room assisting. Biofield aura, something that you would expect to be very common, is less so than the touch sensations. In the aura, one thing that came out was the waves of energy, seeing sort of like a shimmering effect or a mist basically arising while they were working on the client. Light filling and dissolving, this is the common technique. The chakras were less commonly seen, actually. I only had one experience in a class where a nurse got very excited. She's like, I see it, I see it. And she saw this mist in the throat chakra, basically. But it's really less common to actually see chakras than you would imagine. Auditory sensations also involving guides, and mostly through the mind, as one respondent noted, mainly communication through my mind and not so much my ears, though some talked about actually hearing voices during sessions, giving them advice on how to treat the client, or giving them messages to give to the client later. These are just really interesting, all the different unusual sounds that healers have heard: pulsating energy, vibrations, tones popping. Multiple actually wrote about a pop sound that they would hear in the room when there was a release. Ringing, unusual bells chiming, snapping, and unusual melodies too in the room. Very interesting stuff. Finally, the last one I wanted, the sensation I wanted to cover was the smell or taste sense. And It was interesting me. It was very few, very seldom that they would sense an odor in the room. But a number of the odors, a lot of the examples they gave were actually of deceased loved ones of the client. It was sort of took me by surprise. They would have a distinctive odor in life, and so that that odor would appear in the healing session, and the client and healer would interpret it that the deceased loved one was in the room during the healing session. So then one example is the cherry pipe tobacco. Basically one example, an unusual scent. Another, and I'm almost done, another is a beautiful scent, working with a client who passed away shortly afterwards. And of course there's a long historical references of the odor of sanctity of a holy person right before they die. So it was interesting someone brought that out in their descriptions. Finally, just in a summary, just to note that the major way that healing touch practitioners sense what's going on is through sense of touch with these other senses, and contributing also in inner knowing, non-physical guides. And so this rich variety of experiences may offer clues to what we can measure with scientific instruments. And I just wanted to acknowledge healing touch instructor who basically went over my survey for me, offered some suggestions. Healing Touch Worldwide Foundation and Parapsychological Association funded my magnetic field experiments, and I just wanted to say thank you. Okay, thanks.
So we have 5 minutes for questions.
Hey, Margaret.
Hi.
Margaret and I have done research together.
Yeah.
Have you ever looked at some of the sensations that people have and directly correlate that with either the effects in the room? And where I'm coming from is in my experiments with mice, some people felt something, some people didn't feel anything at all. And it didn't seem to have any relationship to healing efficacy. And so I just raised that as thinking about it in a different way.
Yeah, no, actually, the experiments I'm doing now, I'm looking at heart rate variability and random event generator output of healers. And I'm actually finding that efficacy might be more related to their high frequency component of their HRV and also the reg. And the magnetic field doesn't really show it may not show efficacy, basically, or so it's interesting. And also, I wanted, from doing this, I'm curious now. I can sort of look at what sort of sensations to basically study in detail.
Yes, Margaret, I'm wondering if you've ever made an attempt to correlate the work of Alexander Gurwitch in biophotons with healing touch stuff and the sensory perception of it.
Yeah, no, I know there's photons, and even Joins and Duke did an interesting work. Thank you. Good. No, I'd like to do a light emission. It's on my sort of bucket list. Thank you.
Thank you for the interesting talk. I have two questions. The first one is, does the healing touch work through surgical gloves? And do you worry about transmission of MRSA when you touch the patients? Do you have any safeguards for that? The other question is, what instrument did you use to measure the magnetic field, and what is the amplitude of the magnetic field that you see in the changes?
Well, I'm looking at millivolts, basically, about 9 millivolts max or something. So it's very small, very small. I use a single-axis magnetometer. That's a Hall-type magnetometer from Integrity Design. Integrity Design. What?
Yeah, the brand.
Beg your pardon?
What brand magnetometer?
Integrity Design and
okay.
Research. Yeah.
Okay.
They make a lot. And what was the other question?
The other question was, does the healing touch work through surgical gloves, or do you wear surgical gloves? Is it necessary? Do you have any safeguards against transmission of MRSA in the hospital?
No, the concept is more there's an energetic transfer. And so what they do is they ground themselves after, and they cut the connection. Sometimes some healers will actually go to the wall and sort of ground anything they might have picked up. They shake off stuff. So it's an energetic transmission thought. And actually, years ago, there was a talk at ICEM about some practitioners that had worked with a lot of cervical cancer patients and ended up getting cervical cancer. And I wonder if it wasn't microbe versus it was energetic. So I'm not sure. But
Yes, but when you touch one patient
Yes.
and then you go and you touch another
Yes.
patient, if that patient has
they usually
MRSA,
wash their hands afterwards.
They do, that's what I'm
because
wondering.
it's another way to cleanse the energy. Yes,
Okay,
they do
that's-
wash their hands. Yes.
that's what I was wondering.
Thank you. Okay, that's it.
Let's thank Margaret again.